Hello everyone. Today we'll be talking about Buerger disease. Buerger disease is also called as thromboangiitis obliterans. Defining Buerger disease first, it is a inflammatory segmental involvement of small and medium-sized vessels with ischemic lesions. Okay, in a definitions, we have to contain these three things: inflammatory segmental involvement of small and medium-sized vessels with ischemic lesions. Okay, so lastly we can define Buerger disease as a segmental inflammatory. Okay, segmental inflammatory involvement of small and medium-sized vessels with ischemic lesions. Those disease is called as Buerger disease. It extends from distal region to proximals. Okay, and it occurs in a populations of less than 40 years of age. Okay, inflammation involved in artery, veins and nerves. Okay, now let us talk about pathophysiology first. Okay, in the pathophysiology we can see over here. Okay, so initially smoke is one of the smoking is one of the factor for here. Okay, so smoke, okay, which contains carbon monoxide and nicotinic acids. Okay, when it goes into blood, what happens? It combines with hemoglobin and it forms carboxyhemoglobins. Okay, when it forms carboxyhemoglobins, what happens? It causes initially vasospasm. Okay, there are three layers in the blood vessels. Okay, so this in intima layer of the blood vessels, what happens? There is hyperplasia, also there is vasospasm. Okay, so blood vessels spasm take place and also there is hyperplasia of the intima. Okay, as a result, when there is hyperplasia of the intima, what happens? There is due to vasospasm and then the hyperplasia of the intima, what happens? The lumens became small. Okay, it becomes narrow. Okay, so what happens? As a result, there is stasis of the blood. As a result, there is activation of Bartholin triad. So Bartholin triad means what? There is injury, there is stasis and fibrin formations, thrombus formations. Okay, thrombus formations, that means there is thrombosis. Okay, there is now obliterations of the vessels. Okay, also there is penetritis. Okay, and then there is what? There is involvement of artery, nerve and veins. Okay, so when there is thrombosis and obliterations of the vessels, there is penetritis, involvement of all artery, nerve and veins. Okay, so involvement of all artery, nerve and veins. So as a result, when there is nerve involvement, what happens? There will be rest veins. Okay, that is the things. And then patient present with rest veins. So when there is blockage over here, what happens? Blood vessels blockage is over here, then what happens? The collaterals used to opens. Okay, initially in a compensated state. Okay, so if the collateral opens to provide the blood supply over that regions, that is called as compensated mechanisms. Okay, if the patient, if the patient again smoke, okay, what happens? Then these collaterals also blocks. As a result, what happens? There is critical limb ischemia. Okay, there is critical limb ischemia. Okay, so in this way we can describe the pathophysiology. So again, let us revise that things. So initially patient smokes. Okay, his smoke contains nicotinic acid and the carbon monoxides. Okay, and this carbon monoxides initially causes vasospasm and then hyperplasia of the intima. Okay, as a result, what happens? There is thrombosis, obliterations of the vessels. Okay, and then there is penetritis and there is involvement of artery, nerve and veins. When there is involvement of nerve, there will be rest veins. Okay, then what happens? There is artery blockage. So as a result, there is collateral open, and is called as what? And it's called as compensated state. If again the patient smokes, okay, then what happens? It result into decompensated state, and as a result, finally there will be critical limb ischemia. Okay, so what is the triad of these things? Okay, so when there is this process going on, then there is clinical feature. Okay, so there will be restraints exactly. Okay, but we can describe the clinical features of Buerger disease in the form of triad, that is called as RIM. Okay, we can remember with the help of RIM. Okay, so R for Raynaud phenomena, I for intermittent claudications, and M for migratory superficial thrombophlebitis. Okay, this is the things. Okay, so how we can diagnose the case? Okay, we can diagnose the case with the help of investigation, with the help of these investigations. Okay, so first investigation is fourth limb angiography. This is the investigation of choice. Okay, also supportively we can look for hemoglobin percentage, blood sugar. Okay, ankle brachial pressure index we can also look. Okay, this index as well. Okay, and also we can do arterial Doppler and duplex scans. Also we can do CT angiogram. Okay, now the patient is diagnosed with the Buerger disease. Okay, so how we can treat the case? So we have to treat the case with the help of what? First things to do is smoking cessations. Okay, so smoking will be stopped. Okay, so smoking abstinence, and then we can do Buerger exercise. Okay, also we have to do care of the food. We should not expose the food to the cold area. Okay, that is the things over here. Okay, also we can give vasodilator, that is xanthinol. Okay, xanthinols and what xanthinols and nicotinate. Okay, also we can give pentoxyphylline. Okay, and also uh, surgically we can do a lumbar sympathectomy, metal transpositions, and for gangrene we can do amputations. Okay, so Buerger disease is a disease which involves medium and small size vessels. Okay, it occurs in the less than 40 years of populations. Okay, there is a tract that is called as RIM. RIM means Raynaud's phenomena, hyperintermittent claudications, for migratory pains. Okay, so what happens, you can see over here migratory what migratory superficial thrombophlebitis. Okay, and then there is a pathophysiology going over here. The main pathophysiology is dependent upon the carboxy hemoglobin, that is due to carbon monoxide and the nicotinic acids. Okay, and then lastly there is compensated and decompensated state. In decompensated state there is critical hemicemia. Okay, so the feature will be already we discussed about that thing, and then we will investigate the case looking for arterial angiography. Okay, and then we will be looking for arterial pressure, brachial pressure index, and then we will be doing arterial Doppler and duplex scan, CT angiogram. Okay, lastly we will treat the case. We will be treating the case. Initially we have to give we have to stop the smoking, and also we have to do Buerger exercise, and then we have to cure the food. Okay, and then we can give vasodilator, that is xanthinos, nicotinate, pentoxyphylline, and lastly we can do sympathectomy, lumbar sympathectomy, metal transposition, and for gangrene we can do amputations. Okay, in this way I discuss about Buerger disease. Okay, thank you.